is absent. Exogenous insulin is required for treatment. Type 2, non-insulin dependent diabetes mellitus, more common, gradual onset, age middle-aged and directly elderly, usually mild, usually multifactorial. Type 2 is non-insulin dependent, elder people are usually mild, rarely ketosis, insulin resistance is the cause, then oral hypoglycemic agent and insulin in the treatment. Then lepromatous and tuberculoid leprosy, lepromatous leprosy caused by Mycobacterium leprae, diffuse infiltration or numerous flat or raised, poorly defined, shiny, smooth, symmetrically distributed lesions. The lesions are bacteriologically positive, that is multibacillary, longer incubation period of 3 to 5 years. Lepromin test is negative or weak. Antibodies more pronounced, that is IgG and IgM. Lepromatous leprosy, the IgG and IgM is tuberculosis, means it is caused by Mycobacterium leprae. One or two well-defined lesions which may be flat or raised, hypopigmented, and erythematous and are anesthetic. The lesions are bacteriologically negative, that is called postibacillary. Lepromatous leprosy, it is multibacillary, is postibacillary. The shorter incubation period, lepromin test is positive, antibodies are less pronounced. Treatment in lepromatous, it is rifampicin, dapsone and clofazimine, and deformity may be present. Treatment is rifampicin and dapsone, no deformity. Antigenic shift and antigenic drift. Antigenic shift means sudden or complete major change occurs in virus. Result from genetic recombination of human DNA with animal or avian virus can cause major epidemic or pandemic involving most or all age groups. Then antigenic drift means change is gradual over a period of time due to point mutation in gene or gene owing to selection pressure by immunity in the host population. The point mutation to genetic recombination. Antigenic shift, it is due to genetic recombination. Antigenic drift, it is due to point mutation. Then substantiated answer with the integrated vector management is an effective strategy for malaria control. No simple method to ensure controlled transmission of malaria. Of all cases, possible stages of vectors are targeted in integrated vector management. This will help in achieving greatest disease control benefit in the most cost-effective manner, while minimizing the impact on ecosystem and adverse side effect on public health. IBM also helps to reduce the development of insecticide resistance due to over-dependence on it. So, integrated vector management, it is not single, it is a simple method to ensure control of the transmission of malaria. Or possible stages of the vectors are targeted at integrated vector management. Then appropriate technology is suitable for healthcare in developing countries. The main problem in developing countries are lack of money, poor infrastructure, limited human resources for implementation of healthcare services. These problems can be minimized with the use of appropriate technology. Example, ORS for treatment of diarrhea, vaccine vial monitor for over the vaccine vials, and spoon provided with vitamin A for vitamin A supplementation. So food toxicants, beta-oxyl aminoalanine BOA found in seeds of pulse like kesari dal, neurolathris, aflatoxin, Aspergillus flavus cause aflatoxicosis, sanguinarine from argemone oil cause epidemic dropsy. Pyrrolidine alkaloids from Junjunia seeds. Endemic ascites. Fusarium toxins from the field. Fungi Fusarium incamentosa. So the aflatoxins and morbidity indicators. Incidence, the attack rate, secondary attack rate, prevalence, point prevalence and period prevalence. So morbidity indicators are incidence, attack rate, secondary attack rate, prevalence, point prevalence, period prevalence. Salient features of the Factories Act, enacted by the Parliament in 1948, latest amended in 1987. Scope to act defines factory as an establishment employing 10 or more workers where power is used and 20 or more workers where power is not used applies to whole India except the state of Jammu and Kashmir. Health, safety and welfare, cleanliness, lighting and ventilation, provision for treatment of waste and effluent so as to render them inoculous and for their disposal, provision for the elimination of dust and fumes, provision of spittoons, control of temperature, minimum of 500 cubic feet of space for each worker. Precautions to be taken for ensuring the safety of workers. Separate chapter relating to specific welfare measures. And employment of young persons. Prohibits the employment of children under 14 years or adolescents between 15 to 18 is allowed to work only between 6 a.m. and 7 p.m. Hours of work minimum 48 hours per week, not exceeding 9 hours per day, with rest for at least half an hour after 5 hours of continuous work. For adults, it has been reduced from 5 to 4 hours per day. Leave with wages. Besides weekly holidays, every worker is entitled to leave with wages after 12 months of continuous service. Occupational disease. The Act gives schedule of notifiable disease. Occupational disease, the Act gives schedule of notifiable disease. It is obligatory that a factory management is give information regarding specified accidents and occupational disease. Employment is hazardous process. The central government has incorporated a new chapter 4A relating to hazardous process. Then MDG, eradicate Millennium Development Goal, eradicate extreme. Goal number 1, eradicate extreme poverty and hunger. Achieve universal primary education, promote gender equality and empowerment, reduce child mortality, improve maternal health, combat HIV or AIDS, malaria and other disease, ensure environmental sustainability, develop global partnership for development. Biomedical waste management hospital setup, waste category treatment. Category 1 is human anatomical waste, incineration, deep burial. Category 2 it is animal waste, incineration or deep burial. Category 3 microbiological or biotechnology waste, local autoclaving, microwaving or incineration. Waste sharp, disinfection, chemical treatment, autoclaving, microwaving, mutilation or shredding. Category means discarded medicines and cytotoxic drugs, incineration. Category 6 solid waste incineration, solid waste disinfection by chemical treatment. So human anatomical waste is there, animal waste is there, microbiological or biotechnology waste is there, then waste sharp is there, discarded medicines is there. Category 6 solid waste. Okay. The rest we will discuss. Next question. Then comes category 8 liquid waste disinfection by chemical treatment. Category incineration or disposal by municipal landfill. Chemical used in disinfection. Color of bags. Yellow for category 1, 2, 3 and 6. Red. Yellow, red, blue, black. Black and discarded medicines. Blue 4. Blue waste sharks. Yellow anatomic and animal waste. Red 367. Okay. Next question paper we will discuss in the next video.